Hello, welcome to the week 4 synchronous session. This is for NU 636 Advanced Pharmacology. My name is Dr. Christy Burks. We're going to go ahead and get started. On the agenda this week, we're looking at the announcements, the unit objectives, the readings, videos, and presentations, as well as the assignments. On the welcome to week 4 announcement, this is similar to the previous announcements. It just goes over the objectives, looks at the reading, videos, and presentations due, as well as the assignments that we have this week. The next announcement is just a reminder that you should be referring to the synchronous session schedule and links announcement each week. This shows you where the link is or any updates for the synchronous session, as well as the recorded links for the content and synchronous session. Week 4 is a very important week. There is an example template, so I suggest or highly recommend that you take a peek at that to make sure that you maximize your points on that assignment. And then there are some optional journal articles and resources for you to look at. We have made it through the halfway mark of the midterm for this 8 weeks, so congratulations. This is the midterm connection or course connection for this week. I will be sending out an email later on. Likely it will be on closer to Sunday. That way we have everything graded and everything submitted. Typically it will go through week 3's items. That way you know kind of where you're standing or your current status in the course. Do remember we have lots of points in this course. However, it's always best that you always strive to maximize your points each week. So that way you don't come to the end of the course and need 1 point to get to an A. Okay. I am going to be available for a one-on-one meeting either through Zoom, email, or even by phone. It is not a mandatory meeting. It's just offered if you would like to discuss your status or anything in the course that you might have questions about. When I send this email out, please just reply to it in order to set up a meeting. This is just a reminder about the APA resources announcement, and you can go back and look at it. It does have the links on there. You can also get to the APA resources by going through the library as well. For the unit objectives this week, we are looking at new content, and we should be able to discriminate among the mechanisms of action for major classes of the pharmacotherapeutic agents utilized in the primary care setting across the lifespan. Critique evidence in support of proposed pharmacotherapeutic protocols for appropriateness of application in the primary care setting across the lifespan as well. Finally, and then propose the pharmacotherapeutic protocols for selected clients, evaluating safety factors while utilizing knowledge of how current health status, age, gender, culture, genetic factors, ethical concerns, patient values, and prescriptive authority impact decision making. And lastly, when proposing pharmacotherapeutic protocols for selected clients and teaching learning, the teaching learning needs of the clients are addressed to maximize efficacy of the planned protocols. We have 4 chapters. We're looking at chapters 25 and 26, which go over the gastric functional and inflammatory bowel disorders, as well as gastroesophageal reflux disease and peptic ulcer disease. Then chapters 27 and 53, which look at liver disease and weight loss. And then you have 2 video presentations, the Pharmacology Made Easy, which is the gastrointestinal and antiemetic drugs, and weight loss drugs for obesity. Now, as for our assignments this week, our first one is the discussion. So just your instructions are similar to the instructions that we've had each week with our discussions. Your initial post should be 250 to 300 words. It needs to be a substantive post. You need to demonstrate topic knowledge and scholarly engagement, which means including your references and in-text citations. You should have 3 posts, your initial post as well as your 2 minimum peer posts, and they should be posted on 3 separate days to maximize your points. Pardon me. On your initial post, this week we are looking at a 60-year-old female presenting for a follow-up after an urgent care visit. You are presented with a few details of the assessment and some history, as well as a little bit of lab information. So for the initial post, you're going to provide your diagnosis, and then you're going to discuss how you would treat the patient's current presentation and provide a rationale supported by those scholarly references, as well as those in-text citations for your treatment plan, and then include your specific prescriptions that are for that patient. And that should include the medication name, dose, route, frequency, as well as any special instructions that apply when you would write that prescription. Next, you're going to describe the patient education that you would provide in relation to your treatment plan. This should also be supported by references and in-text citations. And then on your peer posts, please make sure that you are making this as a substantive post. It should be furthering the conversation. It needs to be supported by new references and in-text citations. So you should not be seeing the same references, or at least including one new reference within the peer post to present. This way it expands the conversation and presents new research or new information. The peer post is still doing the same as you have been doing. You're going to take the perspective of the nursing program that you are currently enrolled in and answer the question, or go through and look at the peers posts and decide how to address it in a substantive manner. So if you're a nurse educator, you're going to go through and explain your thoughts about the patient education provided in the plan of your peer, and then whether or not you want to comment on or add to the education provided, or present new information with a new reference or article. The last assignment we have is the Unit 4 quiz. And on the Unit 4 quiz, it is the same. So please don't wait until the last minute. You still have 30 minutes, which is about 90 seconds per question. This is not the right due date on there, but this was for last fall. So please make sure your due date is due on Sunday at 23:59. There is no backtracking. And lastly, we're going to look at this assignment, which is comparison of anti-obesity agents. And real quick, let me go back here. All right, on the comparison of anti-obesity agents, this assignment students typically do really well on. It's a good way to maximize your points because you are going to create a table that summarizes the following anti-obesity medications that you can save and utilize later in your clinicals. So for each of these 4 drugs, so you have orlistat, semaglutide, and the phentermine and topiramate, as well as the naltrexone and bupropion. So you're going to create this table, and for each of these 4 drugs, you're going to go over the mechanism of action, the indications for use, the contraindications for use, potential side effects, expected weight loss, the estimated cost of medication, as well as a minimum of 2 supporting references for each of those medications. So your mechanism of action, your indications for use, most of this is going to have in-text citations within it and your references on the last page, which we'll go over in just a moment. So one thing I do want to point out, you are to prepare the table within whether you have a MS, Microsoft Word, or a Mac. You're going to do it within that, and then you're going to have to PDF it to retain your formatting. Remember, you do need a minimum of 2 references to support the information with each medication. So please make sure that you meet that recommendation. And let's quickly look on the rubric. You'll see that you quickly lose points. Each drug has its own section. And if, for example, let's see, say you only use one reference for the orlistat, you're going to lose 1.5. If you don't support it with either, you quickly drop down on your points as well. So it's just something to be aware of. It's very simple to do. Then the last section is organization, formatting, and APA. Now, granted, it is only worth 2 points, but that 2 points can be the difference at the end of the semester or at the end of the term of an A or a B, or passing or not passing. So please make sure that you maximize those points. Now, real quick, I'm going to show you there is a template on that synchronous session schedule and links announcement we looked at, and it gives you an example of what your paper should look like. So APA style link is available several different places. We've talked about it. It's throughout the course. It's in the library. You can go to a student. So you're going to format your paper as a student paper format. And this shows you exactly how to set one up. You should have a page number. You start around 4 to 6 lines down from the top with your title. Everything is centered. Your title is going to be bolded. Then there's 2 double spaces between the title and your student name. And then you're not bolded anymore, but you keep it centered. So you have your student name, and then we resume double spacing throughout the rest of the paper. So you have your name, and then you have the department and university, your nursing course and information, your instructor, and then your due date. So again, the template, this is an example, or the view of that. You have the title page. This is the table I want to show you, because this is what your table should look like. You should have the page number. You have the table 1 as a level 1 header. But for the tables, you're going to only have this top line and this next line that kind of separates the medication name, the mechanism of action, indications of use, contraindications, potential side effects, expected weight loss, and your estimated cost. So this is how you break down each of your sections. And then you have your 4 drugs. Notice there are no lines in between each of these separating this. So you only have 3 lines that make up the table. So please make sure that you are doing this appropriately. Your table title is right below the table 1, and it is left aligned with italicized. And then once your information, now remember, you should be including your in-text citations in this whenever you are putting the information in here. All right, these are just a couple examples of in-text citations. And again, you can find this in the APA style link at the website. But you should be including a reference page as well with the page number, your references as your level 1 header. Everything should be left aligned, and references should have a hanging indent. Please make sure you are including your DOIs and URL links within your information for your reference. And this is just an example of the textbook, whether you use the physical or the ebook. All right. That concludes our synchronous session. If you do have any questions this week, please feel free to reach out to me via email. I hope you all have a wonderful week. Thank you very much.